into the room, I would check the patient's chart for any mobility limitations, and I would also make sure that this is the right patient to be getting a urinary catheter in, and I would go ahead and check for any allergies and gather my equipment. So I would come in, perform hand hygiene, make sure that the curtains are closed. Hi, my name's Alicia. I'm going to be your student nurse today. Can you go ahead and tell me your name and date of birth? All right. And do you have any allergies? No? And any allergies to any latex or iodine? Also no? All right. So that looks like it checks out on your wristband. So today we are going to go ahead and give you a urinary catheter because the doctor has said that you can't pass any of that urine. And so that's just going to go ahead and take it out for you. So hopefully that brings down your pain. It is a little bit of a painful procedure, but it's pretty quick, and once it goes in, it shouldn't be painful anymore. But if you do feel like something's wrong, or if you're in any too much pain, just let us know, and we'll go ahead and stop that and reassess at that point. I'm going to try and keep you as covered as possible, so let me know if you're uncomfortable, but I do have to expose you just a little bit. I'm sorry. So I've raised the bed to a working height. And I'm going to go ahead and put on some gloves real quick. Alright, let's go ahead and get this down. Alright, we're going to get you put up and then frog leg position. And then we'll get you covered back up just a little bit with the blanket. As much as we can. Alright, so prior to doing anything with inserting, I would go ahead and make sure I wash our perineal area good and make sure that is all dry before starting. And I would do new gloves before I do that, and I would take these off after and apply hand hygiene because I'm about to be sterile. So now I am opening my sterile field away from me and only touching the outside part. Alright, and I am touching my gloves and this only on the outside as well. Alright, so now I will don my sterile gloves. Alright, so I've got that. I'm going to touch this from my sterile part. And I would go ahead and make a little cuff around here so that I can put it under her. Alright, so I'm going to ask you to go ahead and lift your buttocks up for me so that we can get this drape under you. Alright, Julia? Good. Alright. Tuck that under. Good. And then making sure I'm still touching the inside in the sterile part. I'm going to move this over here. Alright, so now everything's sterile. I can move that. And I will take the cap off of my saline, my sterile water, and slowly remove this. Alright. And I know that this is coming out, but that is, in a real situation, this would not happen, but it has been happening the entire time. So, I'd make sure that that was securely connected, but for pressure reasons, it is doing that. I would go ahead and open my swabs And then I would also pour out a little bit of the lubrication jelly. And I would slowly feed this out so I can make sure that it is not going to touch anything else. And get it, the first tip of that in the lube, and make sure that I'm getting a little bit of that lubed up. Again, usually this would stay on. Alright, so now that everything is connected, I am going to use my non-dominant hand to pinch this open and grab my cleaning swabs. I'm going to do one swab to this side and dispose. One to the other, and then one down the middle. Alright, so now I'm going to insert this until I get urine, and then once I see urine flow, I'm going to go about 2 to 3 inches deeper just to make sure that I've got it in there. Alright, and now I would hold on to this to make sure that it didn't come out, and I would go ahead and, again, I'm not sure why this is coming out, go ahead and start inserting my water. To inflate my tube. In this situation, I would have a partner hold this so that I would be able to fully inflate. Alright, so now I'm going to fully inflate this, my balloon. Alright, and once it's fully inflated and stuck in there, I would disconnect this and tug on it to make sure that it wasn't coming out. And then I would re-clean the perineal area, and just to make sure that that is nice and clean and dry. And then I can take off my sterile gloves, and I would go ahead and attach this and make sure they give a little bit of leeway, and attach this to their inner thigh. So I've got that. I would dispose of everything. Right now, this is attached, and then I would get them back in bed, nice and covered, and I would get them covered, cover up with those, and go ahead and attach the bag to the frame of the bed so that it is not going to move whenever the bed is moved. And then immediately I would obtain a urine specimen and send that down to the lab. And then after that, they're all covered. I would ask if they need anything else, make sure that the call light is in place, perform hand hygiene, and I would be good to go. Do you have anything else, Julia? No? Alright. Again, at this point, they would be completely covered and nice in bed with the blankets on. Alright, so since that's all, I'm going to go ahead and go. You let us know if you need anything else, alright? Thank you.